The new strain called the VB variant damages the immune system, weakening people's ability to fight everyday infections and diseases much faster than the previous HIV strains, according to research conducted by the University of Oxford. People living with a newly revealed HIV subtype experience double the rate of immune system decline, CD4 count, have higher HIV viral loads, which is the amount of virus in the blood, and are vulnerable to developing AIDS within 2 to 3 years after diagnosis. The study also revealed that the variant has been circulating in the Netherlands since the late 1980s and remains receptive to HIV treatment. So far, in excess of 109 people, most of whom live in the Netherlands, have the variant. Weighing in on the recent study that has uncovered a new strain of HIV was Health Minister Dr. Frank Anthony, who was asked during his COVID-19 briefing on Wednesday what new approaches local health personnel will use to improve the overall response to HIV. He said that while information is not yet available on the widespread circulation of the variant, once it is proven to be circulating globally, it is likely that a local treatment regimen would have to be adjusted to cater for those infected.
If it has circulated globally, then obviously we'll have to review our treatment protocols to make sure that, first of all, we are able to identify these types of patients and then to be able to adequately treat them. I think more studies would have to be done to see whether or not the antiretroviral meds that are being used, the protocols that are being used, would be adequate to treat these patients.
In the midst of COVID-19, efforts towards bringing an end to HIV/AIDS have been sustained but interrupted. Advisor to the Minister of Health, Dr. Leslie Ramsamy, has admitted that over the years there has been some complacency in the country's response to HIV. He committed to ensuring the resuscitation of aggressive educational campaigns and other initiatives to spread awareness about the virus. On Tuesday, the minister said 2,400 persons living with HIV have neglected to access treatment because they are terrified they will contract COVID-19 if they leave their houses. There are approximately 9,000 people living with HIV in Guyana currently, with 71 new cases added to the total last year. Notably, despite several efforts by the Ministry of Health through the National AIDS Program Secretariat to sensitize and encourage persons living with HIV to get vaccinated, the uptake by this cohort of the population has been low. The Joint United Nations Program on HIV/AIDS has indicated that a newly identified variant does not represent a major public health threat, but underscored the urgency in speeding up efforts to halt the HIV pandemic. Temika Rodney reporting for the HGP Nightly News.